The condition I've got is called bile acid malabsorption or bile acid diarrhoea, and it is fairly well controlled with medication, but it does mean that times when I do have a flare-up, it means that I can't leave the house. I have to be near a toilet, or when I'm at work I have to be fairly close to toilet facilities. So the annualised hours are really, really good, because on those days when I'm not feeling so good, if it's a really bad day, then I can work from home, or I can actually start later and come in to the office or to whichever site I need to be at a bit later in the day, and then finish early or continue working my hours in the evening. Because of the nature of my role, I can be more flexible around where and when I do a lot of my work.
I was diagnosed with multiple sclerosis in 2003, and I have continued to work apart from during mat leave since I was diagnosed. One of the things that my GP told me when I was first diagnosed was that people that stay focused on just carrying on with life, particularly carrying on with work, were the people that she'd observed were the people that did the best. And over the years that I've had the disease, it's been my reflection that staying at work keeps me well, and DCHS has helped me do that.
I was diagnosed with dyslexia approximately 18 months ago after joining the organisation, and thanks to the DCHS, they sent me on to be assessed properly, and advice about software to help me was provided, which DCHS purchased. They've also given me time and space to develop techniques for managing my dyslexia.
If you're thinking about applying for a job with DCHS and you're worried because you've got a disability, I would actively encourage you to definitely apply. Be open about your disability, because DCHS is a fantastic organisation to work for. They're really supportive and inclusive of everybody, and they treat you as an individual.
I would say if you're thinking about applying for a job at DCHS, go for it. I think we need a workforce that reflects a diversity of people in the organisation, and we would really welcome people with disabilities and long-term conditions into the organisation. I think you bring a strength of character when you're living with a long-term condition, and you understand the need for good healthcare, and that is what we're delivering at DCHS. And I think when you have that insight of knowing what good healthcare feels like for yourself, we can deliver it better to other people.
If you're thinking of applying for DCHS, please do it, because they're very supportive and they will find ways that will help you to adapt with your disability. So don't be afraid, they are very friendly and open to help.
Despite having lots of hospital appointments coming back saying there's actually nothing wrong, couldn't find anything, I continued to receive the support I needed to manage the conditions I was experiencing whilst I was at work as well as at home. Post-diagnosis, my manager has been really, really supportive in ensuring that I do have the right health passport in place and the right support in place from occupational health, as well as regularly discussing and asking how I'm feeling today or this week, not in a big way, but just checking out constantly that things are still okay for me and that things are working, and if they're not working then she's very quick to respond and look at how she can support me in the short term when I'm having a flare-up.
With my team, when they're communicating with me, they know to send tasks into one folder rather than into different folders, because I would struggle to find them in the different folders.
My overall impression of DCHS, caring for people with disabilities, has been really good. I've worked for the Trust for a lot of years, and I've seen for both myself as an employee with a disability as well as other people within the organisation that have disabilities and patients, that the organisation is really supportive in ensuring that people are well cared for and supported to actually do their job and be at work